My name is Dr. Stephen Rabin. I'm a board-certified obstetrician gynecologist. I've been in practice for about 20 years, but for the past 7 years I started practicing gynecology only, and I'm focusing just on patients who are usually finished with their childbearing and are now encountering either gynecological issues or just looking for their general health and wellness at this phase of life. When I decided to practice gynecology only and stop delivering babies, I did it more for my reasons. I wanted to have more time with my family and be able to sleep through the night. But what I came to understand was that there's a huge number of women who prefer to go see a gynecologist only, where we're not running out to deliver babies in the middle of office hours, leaving a room full of waiting patients. So being able to focus and concentrate and not being worried about having 5 things going on at the hospital at the same time as running office hours has been a huge benefit. Again, not just for me, but a lot of my patients prefer to see a doctor who's practicing gynecology only. One of the misconceptions is that it would be preferable or better or make more sense to choose a female gynecologist. Now, having been in practice for 20 plus years, I've definitely had to come up with some answers to that question. But what I've found is that gender really is irrelevant to the field of medicine that you're practicing. For instance, you're not going to pick your cardiologist based on whether or not he's had a heart attack, or only go to a brain surgeon if he's indeed also had a brain tumor. Over the course of my practice, I've treated over 50,000 specific office encounters. I've had lots of experience with my female patients and understand to a pretty good degree all of the variety of problems that women can have. Going to a female doctor, you're assuming that she has the same condition or the same problem that you have, and the truth may be the opposite, that while you're having miserable, terrible periods, she's having easy ones and may actually find it hard to relate to your problems. So I see it being advantageous being a male, because I have no preconceived notions. If you say that the periods are lousy, then they're lousy. And if you say it is such a way, your experience is your truth, and I'm not here to judge that or to make any personal opinions comparing my periods to yours. I believe that there's fantastic female physicians and some fantastic male physicians, and also the opposite may be true. I had a patient recently say that she had the assumption that she ought to be seeing a female physician, but after our visit, she very specifically said, I really believe that gender is irrelevant. You just need a good doctor who's going to listen and have some sympathy and empathy for what's going on.